The Tanner stage is a system used in medicine and biology to describe the physical development of children, adolescents, and teenagers during puberty. It was developed by Dr. James Tanner, a British pediatric endocrinologist, in the 1960s. The scale breaks puberty into 5 stages, stage 1 to 5, based on visible changes in secondary sexual characteristics. In boys, males, genital development, testes, scrotum, penis, and pubic hair growth. In girls, females, breast development and pubic hair growth. The stages in male pubic hair development are below. Stage 1, pre-adolescent, vellose hair appears over the pubes with a degree of development similar to that over the abdominal wall. There is no androgen-sensitive pubic hair. Stage 2, there is sparse development of long pigmented downy hair, which is only slightly curled or straight. The hair is seen chiefly at the base of penis. This stage may be difficult to evaluate on a photograph, especially if the subject has fair hair. Stage 3, the pubic hair is considerably darker, coarser, and curlier. The distribution is now spread over the junction of the pubes, and at this point that hair may be recognized easily on black and white photographs. Stage 4, the hair distribution is now adult in type but still is considerably less than seen in adults. There is no spread to the medial surface of the thighs. Stage 5, hair distribution is adult in quantity and type and is described in the inverse triangle. There can be spread to the medial surface of the thighs. While in female, stage 1, pre-adolescent, vellose hair develops over the pubes in a manner not greater than that over the anterior wall. There is no sexual hair. Stage 2, sparse, long, pigmented, downy hair, which is straight or only slightly curled, appears. These hairs are seen mainly along the labia. This stage is difficult to quantitate on black and white photographs, particularly when pictures are of fair-haired subjects. Stage 3, considerably darker, coarser, and curlier sexual hair appears. The hair has now spread sparsely over the junction of the pubes. Stage 4, the hair distribution is adult in type but decreased in total quantity. There is no spread to the medial surface of the thighs. Stage 5, hair is adult in quantity and type and appears to have an inverse triangle of the classically feminine type. There is spread to the medial surface of the thighs but not above the base of the inverse triangle. The stages for male genitalia development are below. Stage 1, pre-adolescent. The testes, scrotal sac, and penis have a size and proportion similar to those seen in early childhood. Stage 2, there is enlargement of the scrotum and testes and a change in the texture of the scrotal skin. The scrotal skin may also be reddened, a finding not obvious when viewed on a black and white photograph. Stage 3, further growth of the penis has occurred, initially in length, although with some increase in circumference. There also is increased growth of the testes and scrotum. Stage 4, the penis is significantly enlarged in length and circumference, with further development of the glans penis. The testes and scrotum continue to enlarge, and there is distinct darkening of the scrotal skin. This is difficult to evaluate on a black and white photograph. Stage 5, the genitalia are adult with regard to size and shape. In young women, the Tanner stages for breast development are below. Stage 1, pre-adolescent, only the papilla is elevated above the level of the chest wall. Stage 2, breast budding, elevation of the breasts and papillae may occur as small mounds along with some increased diameter of the areolae. Stage 3, the breasts and areolae continue to enlarge, although they show no separation of contour. Stage 4, the areolae and papillae elevate above the level of the breasts and form secondary mounds with further development of the overall breast tissue. Stage 5, mature female breasts have developed. The papillae may extend slightly above the contour of the breasts as the result of the recession of the areolae. Pubertal development typically follows a predictable pattern in terms of onset, sequence, and rate of progression. To identify adolescents who may require further evaluation, clinicians use population norms, with particular attention to individuals who fall more than 2 standard deviations from the mean. Precocious puberty is defined as the appearance of Tanner stage 2 secondary sexual characteristics before age 8 in females or before age 9 in males, especially if progression continues soon after. Delayed puberty is considered when females have not reached Tanner stage 2 breast development, thelarche, by age 13, or when males have not reached Tanner stage 2 testicular enlargement, gonadarche, by age 14. Potential causes of abnormal pubertal timing or progression include idiopathic factors, nutritional deficiencies, variations in hypothalamic pituitary gonadal (HPG) axis function, as well as genetic or neoplastic disorders. And that wraps up our look at the Tanner stages of puberty. As you can see, puberty isn't random. It follows a well-defined sequence that doctors and scientists can use to track healthy development. While every teenager's timeline is unique, these stages help identify when development is within the expected range and when medical attention might be needed. Remember, puberty is a natural process, but if you or someone you know is experiencing changes much earlier or later than expected, it's always a good idea to consult a healthcare professional. If you found this video helpful, don't forget to hit the like button, share it with your friends, and subscribe for more science-based content on human biology. Drop your questions or thoughts in the comments below. We'd love to hear from you. Thanks for watching. Keep questioning, keep exploring, and never stop being curious about the science of life.